Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Epidural Injections. Introduction. Many people have pain in their backs and legs because of problems with their spine. An epidural injection can be effective to help relieve this kind of pain. If your doctor recommends an epidural injection, the decision whether or not to have the procedure is also yours. This module will help explain the benefits and risks of this procedure. Anatomy. The spine is formed of several vertebrae made of bones. The vertebrae are separated and cushioned by softer discs. This allows the spine to flex and bend without friction. These discs also work as shock absorbers, like the shocks of a car. Nerves travel from all areas of the body to the brain through the spine. Nerves carry sensations, including the sensation of pain, to the brain. The nerves in the back are present in a bag of fluid called the thecal sac. Pressure on the nerves by a bone, ligament, or disc may also cause the sensation of pain. Epidural injection. An epidural shot is given to improve inflammation and swelling around the nerves. Improvement or total cessation of pain may take place when the swelling around the nerves is decreased. The medications used will be put very close to the nerves, but outside the thecal sac in a space called the epidural space. A needle is used to deliver the medication. Sometimes this is done with the help of an X-ray machine. The combination of medications usually consists of two types of medications. The first is a numbing medication, such as Marcaine or bupivacaine, to stop the pain. The second is a steroid, such as methylprednisolone, a medication like cortisone that decreases swelling. The first medication usually causes the pain to go away for a few hours. There may also be some numbness or weakness in the legs for a few hours after the epidural injection. In 24 to 48 hours, the steroid starts to reduce the swelling. This helps to reduce pain further. It is normal for the pain to disappear for a few hours after the injection. It may come back and may last a day or two until the steroid medication begins to work. It may take an injection every 2 to 3 weeks to achieve long-term relief. If the pain has not improved after 2 to 3 injections, giving more injections will not improve the pain. Epidural injections may have to be repeated every few months.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
The procedure. Before the injection, the skin is disinfected and numbed with local anesthesia so that you will not feel the pain of the epidural injection. Initially, an IV is placed in your arm or hand. A minute or so later, the medication is injected with a long needle close to the nerves. This is usually not painful, although it may be uncomfortable. During this part of the procedure, you should let your doctor know if you have any pain, especially in the legs. Pain may mean the needle is touching a nerve. You should also tell your doctor immediately if you start to get sweaty or dizzy. After injection of the medications, the needle is taken out and the procedure is completed. Risks and complications. This procedure is very safe. There are, however, several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. Nerves could be injured during epidural injection, but this is extremely rare. Sometimes the thecal sac is entered and spinal fluid is withdrawn. This usually does no harm, but patients sometimes develop severe headaches. If this happens, let your doctor know. The initial weakness that usually lasts a few hours may last a bit longer. In very rare cases, infections may occur. Therefore, it is important to report to your doctor any worsening pain or fever. You should tell your doctor if you have high blood pressure, diabetes, or water retention problems. Finally, the injection may cause internal bleeding, which puts pressure on the nerves. The chance of this happening is again extremely rare, but if you develop a significant new weakness or a bladder problem, you should tell your doctor. If you are allergic to iodine-containing solutions or to local anesthetics or numbing medications, you should tell your doctor. It is also very important to tell your doctor if you're on any blood thinners such as Coumadin, ibuprofen, or aspirin. This type of medication may have to be stopped for a few days, 2 weeks in the case of aspirin, to prevent the risk of severe complications, including paralysis. The injection may not be done if you happen to have a pimple or any type of infection close to the site of the injection. Rarely, patients may have reactions to the medications injected. The steroid used could increase the blood sugar in diabetic patients. It could accelerate the patient's heart rate or increase his or her blood pressure. It may also cause a patient to retain water. Allergic reactions could very rarely lead to death. It is therefore very important to inform your doctor of all the allergies that you know you have, especially drug allergies and allergies to numbing medications. Because of the possible discomfort after the injection, you must have somebody with you that can drive you home, since you will not be able to drive yourself. Rarely, weakness in your arms and legs may occur after the injection. Your doctor will be watching you after the injection to guard against this and other complications. After the procedure, remember to contact your doctor if you develop any new weakness, any new bladder problems, or any worsening of pain or fever. You may have difficulty urinating on the same day of the injection. Call your doctor if this happens. X-rays may be used during this procedure. The amount of radiation used during this test is deemed safe. However, the same amount could be dangerous for the fetus. The drugs used during this procedure may not be safe for a fetus. It is therefore very important to make sure that you are not pregnant prior to this procedure. Be sure to tell your doctor before the procedure is performed if there is any chance you may be pregnant.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Epidural injection is a very safe procedure that may reduce or end your pain. However, as you have learned, complications may happen. Learning about them will help you and your doctor detect and treat them early should they happen. Thank you for using Explain.